We'll quickly look at the next thing which we'll be discussing, and this is what is known as albumin to creatinine ratio (ACR), albumin to creatinine ratio. Okay, of course, ratio you are trying to like compare two things. Which one is higher than the other? Do you understand? Okay. So albumin to creatinine ratio, just so you know, is a urine test. Okay, so they use it in anytime they want to measure anything that has to do with urine. So it helps to dictate when there's kidney damage. And when you measure it, of course, early on, you can help to dictate the disease condition early on. This is especially in people that have diabetes or high blood pressure. So it measures how much albumin, which is a protein that should normally stay back in the blood. So you are trying to measure how much of the albumin is leaking out in urine because there's issues with the kidney. If there's no issues with the kidney, albumin should stay back in the body. So creatinine is a normal weight that should what? Be excreted out of the body. But if there's issues with the kidney, sometimes creatinine is not excreted so much, it's staying back in the body instead. So albumin in urine is called what? Albuminuria. It's one of the earliest signs of what? Kidney disease. Because urine concentration vary depending on hydration. Comparing albumin to creatinine gives a more accurate picture than trying to now measure the albumin directly. Only it. Do you understand? So it's used in diagnosing chronic kidney disease, and when you are treating a patient, you're also monitoring how the patient is recovering from the illness. Okay, so you see normal range, of course, you are looking at what? Probably if the range is high. Okay. Okay, so normal range is about 30, less than 30. If it's going high, then you know that. Okay, sorry, this is albumin creatinine. Okay, protein creatinine rate. Well, albumin is still a protein though. But if you're talking about albumin in specific, then you know it's less than 30 that should be the normal range. So typical result, just like we're saying, less than 30 milligrams of albumin per gram of creatinine. You get it? So moderately increased is when you're having about 30 to 300. Then severe, that's macroalbuminuria. A lot of albumin is being lost through urine. That's when you have about more than 300. So they use it in diagnosing all those diabetes, hypertension, also monitoring chronic kidney disease. As you are treating the patients, you are seeing how they are improving. So key points, a single abnormal result may not confirm. Do you understand? You have to repeat over some time. So factors like exercise, fever, urinary tract infections can temporarily give you a false positive due to the rise albumin levels. Okay. So you have to maybe probably do other tests or from the history and physical examination. Okay. Can further confirm stuffs. Okay. So that's what we got.